Salmeterol, also known by the trade name Serevent. Salmeterol is indicated for the treatment of reversible airway obstruction and for exercise-induced asthma. Salmeterol works by bronchodilation through stimulation of beta-2 adrenergic receptors. The therapeutic classification of salmeterol is a bronchodilator, and the pharmacologic class is an adrenergic. Special considerations for nursing include to instruct patients to avoid excessive use of salmeterol, as this can increase mortality, and that salmeterol can cause headaches, palpitations, tachycardia, abdominal pain, and paradoxical bronchospasm, especially in the setting of overuse. Concomitant use of beta blockers, specifically non-selective beta blockers or selective beta blockers at very high doses, can decrease the effectiveness of salmeterol and can worsen airway disease. Patients on salmeterol should have their respiratory status assessed frequently, and salmeterol may also increase glucose levels. Therefore, in diabetic patients, they may want to increase the frequency of their blood glucose testing, especially when first starting salmeterol. If salmeterol is being used in combination with other inhaled therapies, such as inhaled corticosteroids, the bronchodilator, in this case salmeterol, should always be the first medicine administered. This ensures adequate bronchodilation and deposition of the subsequent medications. In patients with more advanced airway obstruction, it should be noted that salmeterol and Serevent comes only as a dry powder discus inhaler that is actuated by the patient's breath. This requires a bare minimum 30 liter per minute inspiratory capacity with a preference of a 60 to 90 liter per minute inspiratory capacity to ensure that the entire dose is being received by the patient. Many patients with advanced airway disease cannot do this reliably, and therefore should be switched to an alternative therapy where the inhaler type is more suitable to their level of inspiration.
This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.